Our next question is an old friend who's come back to the show, fluoride. This week in fluoride, does reverse osmosis remove fluoride from your water? We got a reverse osmosis system installed to remove forever chemicals, but now I'm wondering if I should be giving my kids fluoride supplements.
Great question. All right. Reverse osmosis works by using pressure against a semi-permeable membrane to allow only water molecules through and stop other particles like chemicals, metals, etc., from getting into the tank that holds the filtered water. Okay. These filters do a really good job at this, but it means that they may also filter out fluoride that might be in your water system if it's naturally occurring or added. If you should supplement your family's diet with fluoride from other sources is really something that you should talk to a dentist about. There are a lot of factors to consider, like the access you have to dental care and regular checkups and cleanings, if everyone is practicing good oral hygiene at home, if they're using fluoride toothpastes, etc. So I actually do want to use this as an opportunity to get on my soapbox, big surprise, about fluoride. So we might as well just transition this one into the sick of the week. Okay, this sick of the week. Firstly, want to just start by reminding everyone that fluoridation at the level that we allow in the US has not been shown to cause harm. And the people who are going to benefit most from it are those who have limited access to dental care. The Canadian city of Calgary removed fluoride from their water in 2011 and actually just voted in 2021 to start fluoridation again, because in the 10 years without it, the number of kids who needed dental surgery increased compared to the number of kids who needed dental surgery in neighboring towns that still had fluoride in their water. Similarly, the town of Juneau, Alaska, stopped fluoridating their water in 2007, and the number of dental surgeries have gone up, particularly in kids who are in a lower socioeconomic class. And this is why I want to talk about this in terms of sick of the week, because it is indicative of an increasing problem with attitudes towards public health. We talked about it in the first episode, but it's worth repeating that public health is about making recommendations and policies for the population instead of the individual. And often those populations are extremely diverse. Someone might say, why would I need to fluoridate my water? I brush my teeth twice a day. I always go to the dentist for cleaning twice a year. Thinking about the individual, I might say, not everyone is educated about fluoride and its importance. Not everyone has access to regular dental care to get annual fluoride treatments or have someone see when there are starting to be issues with tooth decay. Adding fluoride to water systems is a safe, cost-effective way to help people who are lacking in dental options and education. And if someone were to say, well, why can't we just remove fluoride from all the water and people can choose if they want to supplement it or not? In addition to pointing out that not everyone has the means to find and purchase fluoride supplements or to know how much to take, I would also ask if high-profile people have spent a lot of time and money and effort creating distrust of a public health intervention that has proven to benefit people in order to have it removed, how likely do you think it is that people who need it the most are going to go out and find fluoride supplements on their own if all they have heard are questions about its safety or utility? And this is a real problem for me. Lately, I am feeling like a lot of national policy talk is getting filtered through the lens of the lives and the risks and the needs and access of a small fraction of the population and does not consider the variety of health landscapes out there. To talk about removing fluoride without discussing how you'd replace the benefits it provides people is one example of a health equity issue that seems to get overlooked more and more often in policy conversations that are starting to be had.